Well, here's hoping you don't have to, but visiting an Ontario emergency room right now could take you an awful long time. Just how long, you ask? Well, doctors are telling me tonight ER wait times are the longest they've ever seen.
I've worked in emergency departments since 1987, and it's by far the worst that it's ever been. It's not even close.
The government won't give me the up-to-date information, but the latest publicly available wait time info we have is from November, and it shows patients admitted to hospitals spent over 22 hours on average waiting in the ER for a bed, and only 23% were admitted to hospital from the ER within the provincial target time of 8 hours. Doctors say it's a problem with serious consequences.
That's why you hear on occasion people, dying in waiting rooms because we don't have a place to put them.
That's still happening, doctor? That's happening right now?
It happens. It happens. People being resuscitated on an ambulance stretcher or on a floor. Those things have happened.
Health Minister Sylvia Jones's office turned down my request for an interview, but did provide a statement that reads, quote, "In the past year, we've added over 17,000 nurses and 2,400 new physicians," and says the government is, quote, "investing $44 million to help emergency departments stay open." But doctors tell me the biggest factor in these big ER wait times is the lack of hospital beds to transfer patients to.
If you have 3 sick people and 1 bed, what do you do with them?
I mean, this sounds like a crisis to me.
Well, we've been saying it's a crisis for a long time, and it seems like we're just waking up now. It's late.
Of course, there have been elevated wait times under previous governments, but they've never deteriorated to the level that they have right now. And we've never seen this phenomenon across the province of not just outrageously long ER wait times, but of emergency departments closing altogether.
Government says it's spending more money to keep them open, though.
Well, I mean, the proof is in the pudding. We're seeing year after year longer wait times and larger numbers of emergency department closures.
And staff shortages are another reason that the wait times are so long. But doctors do tell me that if you're sick, don't hesitate. Go to the ER. The sickest are triaged and are seen to right away.